75% of people will respond to the first dose of vaccine. We're not sure how long that immunity lasts.
As Alberta opens vaccinations for anyone 12 years and older on Monday, May 10th, some are questioning the vaccine rollout plan and wonder if it's better to get the first dose in the arms of as many Canadians as possible, or is it wiser to prioritize those waiting for months to get their second jab?
Currently, the plan in Alberta and across Canada is to get as many first doses in as we possibly can.
Short supply of vaccines that we experienced back in January and February are gone now. We're getting a good, steady and an increasing and steady supply of vaccines coming into the country every week. We're in the midst of moving towards a place where that second dose will come more quickly than the outside limit of waiting up to 4 months.
Doctors say at least 75% of people do respond to the first dose of the vaccine, but how long that immunity lasts is still unknown. Yet some say waiting between doses of vaccine has shown better results in some cases.
A study with AstraZeneca showed that those who got the second dose 12 weeks after the first dose actually had a better response than those who got the second dose after only 4 weeks.
To shorten vaccine intervals, some researchers suggest mixing brands with first and second doses. But is this as effective?
Work is going on right now to evaluate that, starting in Canada and then also in the United Kingdom and elsewhere. 2 different vaccines might be better than giving just 2 doses of a single vaccine, because you might get a broader, more complete immune response. However, we know that the amount of immune response and the sort of how broad that immune response is very good with the existing vaccines, where you get 2 doses of just a single vaccine.
Experts predict there is a very high chance that the current recommendation of both doses from the same brand will change between now and when most Canadians will be eligible for their second dose. In Calgary, Henna Saeed, City News.